What's up? I am Jen Rosenbaum, breast cancer survivor, women's empowerer, and creator of the Shamelessly Feminine movement, which you can find at shamelesslyfeminine.com. Today, I want to talk to you guys about a comment that I got on a video that I previously made. The comment was, the video was, what does it feel like after a mastectomy? And the comment I'm going to read to you is from Lisa, and she says, I'm 7 weeks post-op from my bilateral mastectomy with tissue expander placement. I have 2 expansions. I've had 2 expansions, and I'm waiting for my 3rd and hopefully final expansion next week. What size and type implants did you get? Are you much more comfortable with the implants versus expanders? I find the expanders so hard and heavy. Does the skin sensitivity improve? Right now, light clothing still bothers my chest area. Thank you for sharing your thoughts and experiences. Thank you, Lisa, for asking such a wonderful question. I do have some videos in which I talk about expanders when I had them in, but I would love to readdress it because I think it's a big question. And this is one of those areas where the doctors will tell you this is what it's going to feel like, but really they don't know because they haven't done it. So let's start with the first question. What size implants did I get? So my implants are 400 cc, and people ask me all the time, what bra size is that? Now, here's the thing. They do not coordinate that way. So 400 cc on a woman that's larger than me or 400 cc on a woman smaller than me would lead to a different breast size, a different bra size. I don't really know what bra size I am because I don't really wear bras. Well, there's 2 answers to that. I don't really wear bras like that much anymore. A lot of times I just wear something lacy or a little cami or something over my chest, or nothing at all. If I do wear a bra, what I suggest to you, and this is advice from a boudoir photographer and a breast cancer survivor, is go try bras on because the size really doesn't matter. But generally speaking, I think that I'm probably about between a 34B and a 34C. It's also different because there's different distribution in my breasts than it used to be when they were natural breasts. So, and I'll explain that in a minute. So they're 400 cc. Now my implants are actually bigger than my expanders were. So my expanders, I don't remember the exact number that they were expanded to, but I think they were expanded to 300 something cc, I want to say. I don't remember exactly. So when I woke up from my exchange surgery, I was definitely a little tight in the chest area again, just like when you have your mastectomy. Not everybody experiences that. That's just what I experienced. And I don't know why, but I think it is because my implants were a little bit bigger. And I had a choice. I said to the doctor, if you have a choice to go bigger or smaller, go bigger. Because I was afraid that he was going to go too small and then that was it. And I am glad that I did that because I do feel that my chest size is in proportion with my body. And it's fairly similar to where I was before, even though, like I said, the distribution is a little bit different and the shape and the placement is different. My chest is, my clothes fit me somewhat the same, like if I'm wearing a shirt like this, but a lot of other clothing I've had to get rid of, which again, I can discuss and kind of talk about even in another video if you guys want. Am I much more comfortable? Oh, I want to talk to you about the type of implants I have. I have round silicone implants, smooth. This is a crazy story. So when I was first looking into reconstruction, it was November actually of last year, and I had to postpone my reconstruction because I needed chemotherapy. But originally we thought maybe we could do reconstruction around November. And when we talked about reconstruction, my plastic surgeon recommended the teardrop implants that are textured because they look a little bit more natural. So you can see here, I'll see if I can show you. I have like at the top of my breast, do you see how it's kind of like there's not really like a slope. Like most women, see if this side is a little bit, yeah, you can kind of see it there. Most women have, like, if you have natural breasts, you have a natural slope that leads down to your breast implant. I sort of have like what I call my shelf. There's no slope there. The gummy bears, the teardrop gummy bear implants, help with that because they are sloped and they're teardrops. So they literally will go like a teardrop shape. The problem is that even in the 4 months since I said, okay, I'm not having reconstruction now. I'll have it in 4 months from now after my chemotherapy is done. They figured out that those implants, for some reason, are causing a cancer in women. It's not a breast cancer, but it's a different type of cancer. And they believe that it's coming from the fact that it's textured implants. Again, I am not a doctor and I don't mean to be giving any medical advice to anybody. I'm just telling you what my doctors have told me. And they suggested that I don't get those implants. So I didn't. I got the round, smooth, gummy bear silicones, and they call them gummy bears because if you picture like slicing a gummy bear in half, how it's like soft, but there's movement to it, but it's still kind of solid, and that's what my implants are like. So that's the kind of implants that I chose. Am I much more comfortable with implants versus expanders? Yes. Long story short, yes. You said you find the expanders hard and heavy. Yes, they're awful. Expanders are awful, awful, awful. They are better than nothing, of course. Well, I shouldn't say that actually, because some people choose to go flat and that's fine. But for me, it was better. For me at the time, it was better than nothing. I felt like I could wear clothes when I had my expanders and nobody knew what I was going through. But the truth was, one expander was here, the other one was here. Mine were lopsided on top of everything else. So like one was up here, one was down here, and they looked ridiculous. Like, I mean, without my shirt on, it was absolutely absurd. And I had done a photo shoot actually with them because I wanted to remember what they would look like. And even the photographer was like, that is the craziest looking thing I've ever seen. So in clothes, nobody would really know. If I wore a shirt that wasn't tight, nobody could really tell. But they were super uncomfortable. And just like you, I had terrible skin sensitivity. Even just wearing a shirt sometimes bothered me. Forget wearing a bra. I couldn't wear a bra or anything to hide what my expanders look like. I also had 3 expansions. They were aiming for 4, but I could only get through 3. I remember by my 3rd expansion, I was in brutal pain. Just everything was like tight and contracting, and my muscles, like it was really hard to move after. Your body adjusts to it as it goes, but yeah, it's super uncomfortable. But yes, it is a lot more comfortable with implants. However, I will say, when I had my reconstruction surgery, most people said to me, oh, you're going to be so happy you got rid of the expanders and it's going to be so much more comfortable and you'll immediately feel relief. I didn't feel immediate relief from my surgery. It took me some time. I felt like a tightness again, and it brought me back to sort of some memories of the mastectomy. Everybody's experience is a little bit different, I guess. But it took me a little bit longer to recover from my reconstruction than I had anticipated. That's just the honest truth. And again, I don't think everybody has that same experience. People ask me if I'm happy with my breasts. This is a tough question for me to answer, and the honest answer is sort of. Am I happy with them? Yes, I'm happy in the way that I have breasts, or as I like to call accessories, because they don't really necessarily feel like my breasts. But yes, I'm happy that I, look normal in clothes, and I can wear certain things, and I can, it helps with my femininity a little bit. But no, it's not the same. And, a lot of people say like, oh, at least your boobs are going to look great. At least you'll have when you're 80, your boobs will be perky. And they make up a lot of things that like make them feel better and try to make you feel better. And it's said out of love. But the truth of the matter is, no, my breasts do not look like they used to, even after breastfeeding 2 children and being 41 years old. I would still rather have had my natural breasts. And I don't love how I just kind of had that shelf. I actually looked into a fat grafting where they take fat from your stomach and they put it into your chest area to create more of a slope. I'm not a good candidate for it, so I wasn't able to do it for a few different reasons. And from what I understand, it's not a perfected science. That it's very difficult. It doesn't always stick, and even if it does, it's not perfect. So I chose not to have that surgery. But yes, I'm self-conscious at times of my chest and what it looks like in clothing. And I do find it harder to get dressed now than I used to, where I would know exactly, like I could look at a shirt and know that would look good on me or it would flatter me. And honestly, I really loved my chest and I would like to, show a little cleavage here and there. I don't really have cleavage anymore. they're they don't really move so much. They do a little bit, but they're really kind of fixed where they are. So it's just different than having natural breasts, and I'm still getting used to it, I guess I want to say. And I guess over time I will get used to it. And the other thing I like to think of is that technology is always changing, and maybe down the line 10 years from now they'll have a new breast implant that will look more natural and I can switch them out. You never know. That's the thing. Nothing is forever, and we'll see what happens. And yeah, but I have to say, reconstruction surgery is very interesting because it's much better to wake up with breasts than waking up from your mastectomy without breasts. It's a good feeling to do that. So hang in there, Lisa, and I promise you on the other side things will be good. And where you are now is tough. When you're in the thick of it, it is hard to picture your life when you're not in the thick of it. But I promise, when you come out the other end, you'll be good. You'll be good. You'll work through it. And that's what I'm doing too. So I'm still getting used to my breasts the way they are now. And I'm not sure they'll ever feel natural, but the beauty is that I can be out in the world and people don't necessarily know. And I like I said, I can get dressed and I can feel put together, and one day at a time. So that's what it felt like with expanders. I hope that helps you. And yes, the expanders are terrible and awful. And even that part, like where the metal port is, like to even touch that is so brutally painful. And mine like shifted. So they were like in my armpits. They're just awful. But hang in there. You'll get through it. You'll have your reconstruction and it'll feel so much better, I promise. All right, guys, that's the breast cancer lesson for today. I hope you're enjoying these videos. Please make sure you post below if you have any questions. I love to answer them for you, just like I answered Lisa's question. And make sure you subscribe to the channel. Talk to you soon. Bye.